care. We're talking about medical evaluation. The medical director maintains quality control. Everything we do, he looks at. We have continued quality improvement reviews and audits in the EMS system. We constantly have refresher training and continued education, which are very important in our line of work. And our main goal is to minimize errors, whether it be on written paperwork, in the field on a patient, medication, whatever it is. Errors is the one thing that we want to minimize and not have many of. Information systems are used to document the care provided, and a lot of people now are using electronic storage systems, and once they are stored electronically, that information can be used to improve care. And it can also help determine for our own needs if we wanted to come up with the average on time for trauma patients to try to see if we couldn't improve that and make it better. It can help determine the need for educational sessions as far as we see a group of people that need a little bit more training in a certain area. And it also helps determine national trends to see if it's something that not only affects our area, but maybe it's affecting other areas across the state or across the nation. System finance, you can just look at this table. Finance systems vary depending on your organizations, and we won't go through this in depth. You can look at it if you want to. This should be in your book. But just remember, when we're talking about system finances, that personnel can be paid, they can be a volunteer, or some services have a mixture of paid and volunteer. A lot of times you'll see this in fire departments, but you also can see it some in EMS agencies. And as EMTs, you may be involved with gathering insurance information, attending fundraisers, and other activities to secure finances, especially in the agencies that are mixed with paid and volunteer, so that there's always money coming in to help restock supplies, for uniforms, fuel for trucks, just the everyday needs that you have to continue to run your service. And we're talking about education systems. EMS instructors are licensed in almost all states. ALS training is provided in college, adult career center, or hospital settings. And continued education is needed to update knowledge and refresh skills. Just because we get through the class and we graduate and, we pass the class and we get our certification as EMT, that don't mean our education is done. State requires us to continually, every 2 years, to get more continuing education hours. And the majority of it way above what the state requires. Because the skills that we have, we need to practice them over and over and over again to stay up, to know what we're doing when we go into a scene that a patient needs us. Prevention and public education are two components of the EMS system with a focus on public health. And if you look at table 5, you see examples of public health accomplishments. We won't go over these, but you can look at them and see some of the ones that public health has been a help on. When you talk about prevention and public education, the emphasis on for this scenario is on prevention. And EMS works with public health agencies on primary prevention and on secondary prevention. EMS research helps determine the shape and impact of EMS on the, as far as if they're doing good, if they're doing something wrong, if they're hurting more than they're helping. EMTs may be involved in research through gathering data, and evidence-based decision making is based on research. A lot of research, you don't think there's to it, but they will look at all the research done, all the data that's been gathered, and try to come up with a good evidence-based decision making in their decisions they do make.